Welcome everyone. My name is Christine Torjussen. I'm with FHI 360 in North Carolina, but I'm part of a broad consortium of folks across many organizations who are hosting this PrEP Learning Network. And we meet monthly to discuss various issues related to accelerating and improving our implementation of PrEP. And today we have a very exciting session focused on going virtual for provider PrEP training, which I think all of us recognize is a really critical issue now as we're in the middle of the COVID-19 pandemic. We need to be more creative and nimble in how we continue to move PrEP scale up forward, and these virtual options are essential to do that. So next slide, please. So these are our topics for today. We will talk about virtual training approaches, and then we will hear about two examples, one from Nigeria and one from South Africa, about how this is being done. Next slide, please. So these are today's speakers. We'd like to welcome Julia Bluestone. She is with Jhpiego and is a certified nurse midwife who provides technical guidance in education and continued professional development. We also have Wale Durosinmi-Eti, who's from JSI, and he is the chief of party of the JSI program Total Market Approach to HIV Prevention in Nigeria. And he has over a decade of experience in public health programs and currently leads technical and administrative activities for JSI in Nigeria. Next slide, please. We have Elmarie Bredenhan, who's a senior program manager from Wits RHI in South Africa. She also leads their Design for Health team, and she works across several implementation science projects that focus on HIV prevention with different populations. And Kunda Vundamini is also from Wits RHI and is a project manager with expertise in communications and knowledge management. And her experience spans many different topics, as you can see listed here. And we are excited to have all four of these speakers with us today. Next slide, please. So just a little bit of housekeeping before we begin. You may notice if you're an attendee that you cannot speak, and I'm sorry that we can't be more interactive verbally, but we're trying to keep the lines clear for our presenters. But you are welcome to chat with us through the Zoom webinar chat. You'll see a little chat button at the bottom of your screen that you can click on. We ask that if possible, you select in the To section, there's a little drop-down menu. And if possible, please select all panelists and attendees when you write comments or questions, because that allows everyone to see, everyone on the attendee side to see your contributions. If you want to write privately to the panelists, you can also select all panelists. Note that the default is all panelists, so you have to actively click that little arrow and select all panelists and attendees. And we do welcome not just questions, but if you have an experience or even a possible response to a question that is posed in the chat, we do welcome folks to go ahead and put that in the chat. We like hearing about the different experiences across multiple countries. And as I've been chatting, I've just noticed, I mean, we have representation from Mozambique, Kenya, South Africa, Zambia, Zimbabwe, and I'm sure other countries as well on this call. So I'm sure there is rich and diverse experience for us to share with one another. I just want to let you know that in the panelist room, in addition to our speakers, we have a number of additional experts from Jhpiego, from JSI, from WHO, and from USAID, and FHI 360, and if I've forgotten someone, oh, and Wits RHI. So if you have questions, we have not just our speakers, but other experts who can help respond. We also have a Q&A box that you can use to put questions in as well. With no further ado, we will launch into our first presentation. So I'm going to turn this over to Julia Bluestone from Jhpiego, and thank you, Julia. Look forward to hearing your talk.
Great, thanks. Can everyone hear me okay? We could just, if someone can just chat in an affirmative,
Yes.
that'd be great. So good morning, everyone. As she mentioned, my name is Julia Bluestone, and I'm going to be doing an overview looking at how you can make sure you increase your return on investment. Next slide. So this article was released last week in the Wall Street Journal, and the headline is frightening, right? The results are in for remote learning. It didn't work. Now, this was specific to elementary education, but it does highlight some of the pitfalls that you need to avoid when planning for virtual training. And we're here today to make sure that this is not our headline. In fact, we know that virtual training can be equally or more effective than live instruction if properly designed. And what I'm going to do in the 10 minutes that we have together is I'm going to highlight 4 of the design rules that we think are most important to make sure that your learning is effective and it results in the type of outcomes that you want. These design rules focus on the system, the technique, the dosage and frequency, and the plan for ongoing support and mentorship. Next slide. So before we shift to the design rules, I just want to highlight briefly some of what the evidence says about learning. So on the screen, you see a screenshot of an article that we published in 2013 that was the result of a lit review that we completed prior to look at, in the context of health professions' continued professional development, what does evidence support for techniques, frequency, setting, and media used to deliver instruction? And basically what we see across the studies and what we've also learned from our program experience is that no matter how the training is delivered, you need to take the evidence and apply it to the technique, the setting, the frequency, and the media. So before we look at the specifics of that, I do want to just summarize some of the current options for virtual training delivery that many people are using and highlight this last statement on the screen. Like, one of the things we did see across the different studies that we looked at is that digital instruction can be equally or more effective. There's a strong body of evidence to support that, I would argue, if you choose the right design principles. Next slide. So on the screen is just a summary of some of the current virtual training delivery options that are out there. You know, many of you may be familiar with Project Echo's work and using teleconferencing and peer learning to support changes in provider performance. WhatsApp has educator and business profiles that allow you to deliver training, completely on WhatsApp platforms. Of course, that's eLearning. There's various digital learning and eLearning that can be delivered on the phone or computer, on the job or workplace-based coaching or mentoring, which is typically combined with some type of digital learning or instruction. And even now with social media, Facebook has learning units. So there's a range of options that you can use to deliver your training approaches. So now let's shift from that to our design rule number 1, which is focused on the system. Thank you. So as content experts, I think a lot of us are really comfortable with content and we want to jump right into e-learning development. But our argument is, if you want it to be sustained, if you want it to be effective, you have to plan carefully for the system and also for sustainability. I'm not going to go through all the bullets on this slide, but I want to highlight some points for the first 3. The first is identifying who's going to be your local partner or organization that's going to take over or continue the work or own the content. If you don't set that in place in the beginning and make sure you have that local commitment, it'll just die by the time you leave. And so that's the number 1 thing to think about from the front end. Secondly is what incentives will be provided for providers. You have health workers who are completely overworked and you're not giving them per diem. So what is their incentive to complete online or virtual training? Will you provide continued professional development credits towards relicensure? Will you provide some type of certification? You need to think through that to make sure you get the type of uptake that you want. And the last comment I'll make on this slide is really being pragmatic about what are the technology and infrastructure challenges that you're going to face and how will you resolve them. Now let's move to design rule number 2, which is focused on technique. This is one of my favorite topics. How many of you, there's 195 people in this webinar, how many of you have sat through bad e-learning? And you know it when you see it, right? Long narrated PowerPoint presentations, recorded webinars that people talk on and on, like me. So one of the most important things for you to consider when designing your virtual training is the use of effective techniques. When we looked across our literature, that was one thing that came out through a range of the different studies and interventions that were tried. And I put on the screen one of my favorite quotes. This is from a systematic review from 2005 about didactic instruction, which they defined as just reading and lecture results in no to low learning effects. Like, we all know that from our own experience. The techniques that did come out as effective that you can do virtually include clinical simulation, case-based learning, and to some extent, practice and feedback. You can practice communication skills virtually, the hands-on skills. There are different people looking at the use of Google Glass or other like crazy high-tech options, but when you plan your virtual training, really think carefully is how can I make this as practical and evidence-based as possible? So these are the techniques that come to the top. Now, when it comes to the amount of dosage, how much frequency and dosage of practice and feedback do you need for your skill? I'd like to move to the next design rule, which is dosage and frequency. So what we've learned is, one of the things that came out of our lit review that repeated sessions are preferable to one session, right? Which is obvious. But how much is needed? Well, you can determine the amount of dosage and frequency based on the type of skill you're targeting. You want learning to be as lean as possible, but if you have a skill that's very complex and critical, like managing a patient in shock or managing a patient with a complex reaction to ARVs, then that may need repeated practice and frequency. Harvard Business Review recently released an article looking at how learning is retained, and they highlighted if you don't have a chance to apply information immediately, you lose 75% after only 6 days. So we know this to be true, but when you think about how much dosage and frequency, match it to the complexity of the skill. Next slide. The last point I'll make regarding that is that we have outlined for different types of tasks, like for instance, for a new task, you need a longer duration. For a refresher, it could be short, like a quick job aid. So there is some guidance and thinking around how much dosage and frequency you need based on the type of skill that you're targeting. Lastly, let's move to design rule number 4, which is about ongoing support. So Alex Rowe has been leading a literature review that's been looking at the interventions over the last 40 years in low and middle income countries to improve healthcare provider performance. And one of his findings when they looked at training as an intervention, one-time training, it results in very little effect size, 3 to 5%, which basically returns to no improvement after about 20 months. So we know that once is not typically enough, that people either need to directly immediately apply or support to apply that. So in determining how much support you're going to provide on the back end, some of the things that we think are most important are highlighted on the screen. The second bullet comes from some of our experience within Safe Surgery, the Safe Surgery program, where we used a few outcome metrics, specifically surgical site infections and sepsis rates, and tracking those metrics across networks of facilities to see which facilities need additional support or mentorship. So ask the question, are there outcome measures that you can embed within your intervention to make sure that your training is making the difference that it needs to? And if not, then you can pivot. The other thing we want to highlight is, rather than coming in, and I think we all know this, but it still does happen to some extent, coming in with our own systems, is what are the existing district level supervisory and mentorship systems in place that can be built upon? And of course, the last bullet, and I have a link, a screenshot here of the HIV oral PrEP implementation tool, is that decision support tools, performance support, ongoing peer learning. We know the evidence from our lit review show that that can be effective at improving provider compliance with protocols. And I just wanted to highlight, there's a lot of opportunity there with technology, and I know many projects are already using WhatsApp and those type of tools to support ongoing provider performance. And last slide. So in summary, when you think about designing your virtual training, you want to use your donor money effectively, and you want to make a difference in the countries that you support. So if you think carefully and design from the beginning for what's your system sustainability strategy, if you focus on including lean but effective techniques, just the minimum dosage and frequency, and making sure you have follow-up, then you will get a better return on your investment. And I did include a link to the oral PrEP eLearning course, and I think it's a good example of best practices that's available for use. And I will post Christine, I should have thought of this earlier. I will have Jhpiego post in our Twitter feed the links to the performance support tool and the e-learning course and the article that I mentioned. So if people want to find it later, they can just find it on our Twitter feed easily. And I can tag FHI 360. That's it for me. Thank you.
Thanks so much, Julie. And just on that note, at the end of every one of our PrEP Learning Network webinars, we do post all of the sessions. We post the webinar, we post a resource sheet. So I will also have you put those links in our resource sheet for easy access. So those will be sent out maybe about a week after this webinar. That was very interesting. Thanks, Julia. I think we're going to hold questions to the end, and we're going to dive right in to see how this is put in practice in Nigeria. Next slide. I'm going to pass this over to Wale Durosimieti. Over to you, Wale.
Yeah, thank you. Greetings from Abuja, Nigeria. My name is Wale Durosimieti, and I'll be presenting GSI's experience on the training of healthcare providers on PrEP in the context of COVID-19. Next slide, please. So before I delve further into the presentation, I will provide some background information around PrEP rollout in Nigeria. Until a few years ago, most of the activities around PrEP have been poorly coordinated with individual organizations and agencies conducting implementation studies and pilots of intervention. However, in the year 2017, the first interagency discussion on PrEP in the country started with the support of PEPFAR Nigeria. And this was followed by a training of 30 trainers on PrEP implementation and rollouts in some selected healthcare facilities in the same year. I need also to point out that at this time, the priority for PrEP was on the key population groups, mainly the female sex workers, MSN, and people who inject drugs. But during funding year 19, the target group was expanded to include the general population, such as discordant couples and other persons at substantial risk of HIV. So till date, there are about 6,650 individuals who have been enrolled on PrEP cumulatively with the support of PEPFAR Nigeria, with about 5,000 of these enrollees being KPs on the program. Next slide. So talking about the overall training approach, during the month of May 2020, GSI under the AIDS-Free project worked with USAID Nigeria, HIV implementing partners to identify and nominate trainees from public health facilities. In all, we had about 70 healthcare workers that were identified. And these trainees were primarily nurses, case managers, counselors, clinicians, and pharmacists. And once we got their details, we introduced them to the self-study of the WHO e-learning course on PrEP. They were provided with the link to the course, and we also provided them a 2-page guide on how to register and complete the course. Then the team followed up and provided support to trainees via email and telephone calls. And I also need to highlight that most of these supports were to basically remind them to complete the course or to support them to navigate some of the challenges they were experiencing in completing the course. And we then supplemented this e-learning course with 2 groups of webinars involving expert panelists. And at the end of the training and webinar, we ensured that resources from the training, including slides from both webinars and responses to all the questions that were asked, including the audio recording from the webinar, were all shared with the participants. Next slide. So the question is, why did we choose this approach? We did because of the restriction imposed by COVID-19. While the WHO e-learning course is intended as a prerequisite to an in-person classroom training, at that point, we knew that the possibility of an in-person training could be many months away, due to the restriction on travel and also the challenges around gathering people into to have classroom training. So we saw the meetup webinars as an opportunity for us to further the individual learning of the trainees. In addition to this, AIDS-free experience with the voluntary medical male circumcision online training hub has shown us that if the trainees are left totally on their own, many of them will not complete the course and will need additional support. So we had to come up with this approach. Next slide. So talking about the eLearning tool itself, it's a tool that was developed by Jhpiego for clinicians, and the course is self-paced and interactive via the internet, and it's available free to everyone. The course is aligned with the content from the clinical module of the WHO implementation tool for pre-exposure of prophylaxis of HIV. And the online course is divided into 4 lessons or modules, as we refer to them, with each lesson taking about 45 to 60 minutes to complete. As I mentioned earlier, the tool is interactive and it utilizes visuals, narration, and it can also be accessed from a computer or from a smartphone, as long as the user has internet access and is able to reach the internet via audio. Next slide. So the entire course is composed of first a brief course overview. We also have a test and the 4 lessons. The first lesson, which is lesson 1, covers information on how to identify suitable individuals for PrEP. The lesson 2 focuses on the process of starting and managing individuals on PrEP, while lesson 3 covers information around situations or special situations that may arise in clients that are taking PrEP or preparing to take PrEP. And the final lesson, which is the lesson 4, covers information around counseling and ensuring effectiveness and safety while an individual is using PrEP. In addition to this, the 4th lesson also covers information on how to avoid stigma while a client is on PrEP. Aside this content, each of the lessons has technical content. It also has knowledge check as you go along with the lessons. And then at the end of each lesson, there is a quiz that is taken to test the knowledge of the trainee. At the end, you now have a post-test which covers all the 4 lessons. And once an individual is able to complete the post-test, a certificate of completion is generated. Next slide. So this is a screenshot from the eLearning platform showing some of the content for the lesson and test. Next slide. So you just have some of these samples. Next, please. To show you some of the things you have there. Next. And then this slide is showing the information on how to determine the creatinine clearance for the individual to be enrolled on PrEP. Next slide. So once the individual has completed the courses, and we knew that there is this challenge around conducting an in-person meeting after the completion of the course, like I mentioned earlier, we came up with the option of having 2 webinars with expert panelists. The first webinar covered the content from lessons 1 and 2, while the second webinar covered content from lessons 3 and 4. And the panelists presented a summary of the modules, and in addition to that, put the WHO guidance into Nigerian context. And then finally, the panelists also provided PrEP implementation experience from other African countries and used the opportunity to answer questions from the participants during the question and answer sessions. Next. In terms of results, overall, we had 67 ed providers who completed the training. In addition to conducting the training and the webinar, we also conducted an evaluation of the training, and findings from this indicated that about 91% of the trainees found the inclusion of webinar to the eLearning course to be very useful. Also, 80% of the trainees believe that the webinar provided them with opportunity to ask questions and to clarify their understanding of the course. Also, 70% of the trainees said the email and telephone reminders that were put in place during the training and webinar helped them to attend the webinar and also to complete the course. While another 9% of the participants believe that the webinar provided additional information which they didn't get from just doing the e-learning course. And I think this emphasized the importance of having the webinar in addition to the e-learning course. And based on the sources we recorded from the first cohorts, we plan to have 2 more cohorts in Nigeria, one in the month of July and the second one in the month of August this year. Next slide. So in addition to the evaluation that was conducted, we also did a telephone interview with some of the providers who attended the training, and the quote you have here was by one of the nurse participants who expressed that the training has actually strengthened our capacity to identify and to initiate clients on PrEP for HIV. And I think this is a very good feedback to us. Next slide. So this training was not completed without challenges. There were 2 key challenges that we encountered during the implementation. The first was issues around internet connectivity. Some of the healthcare workers were from very remote locations where internet connectivity is really very poor and not very reliable. And this resulted in the slow pace of completion of the e-learning course. In addition to this, some of them experienced loss of internet connectivity at different points during the webinar. The second challenge we had was that some of the healthcare workers had difficulty in creating time to complete all the 4 modules due to competing work activities. And aside these, we also gave them very limited time to complete the course because we wanted to ensure that everything was done within the month of May. So these 2 are the key challenges that we experienced during the implementation. Next slide. Next slide, please. So as I mentioned earlier, we are planning to have 1 more cohort in July and another one in August 2020. And considering the restriction imposed by COVID-19, we believe that this approach is a cost-effective approach to strengthening the capacity of healthcare workers to improve access to PrEP services. And we also believe that it is an approach that can be adopted to reach more healthcare workers in Nigeria and other settings within a very short period of time. However, to be able to overcome some of the challenges that I just mentioned, we discovered that there are certain things that need to be put in place. The first thing is that it is easier for the trainees to actually use the offline version of the e-learning course rather than staying online for over 4 hours to complete the course. The course is available on an app that can be downloaded and installed on the smartphone. And with this, the course can be completed offline without extensive need for access to internet to be able to complete the course. The second thing is that there is need to identify the best locally accessible platform for the webinar from among the several available options. We used Adobe Connect for the first cohort, and we're already thinking that probably we might have a choice between Zoom or Google Meet for the others, because we found that some of the trainees had challenges using Adobe Connect or connecting the webinar through Adobe Connect. And so this is one issue that planners of future trainees need to put into consideration. The third thing is that we also need to ensure that the organizers work with implementing partners or the supervisors of participants to ensure that they are able to create adequate time to complete the course, so that there will not be conflict between completing the course and also the assigned duties to them in the healthcare facility. Also, the expert panelists that are to be chosen for the webinar must be individuals who are very knowledgeable of the local context to ensure that the webinar is meaningful to the trainees and not just a repeat of the content of the e-learning course. In addition, such experts must be well positioned to be able to answer questions that will come from the trainees. More importantly, there should also be a local team on ground to provide timely email and telephone responses to the trainees to support them and to address their technical questions that they may have, especially when they are completing the course. And then finally, the local team also need to keep track of all the trainees who have completed the modules and to send reminders to those who have not completed the course. And because we think that this will help them to be able to keep track of the performance of the trainees and ensure that we have good completion rates in terms of the number of the participants. And we believe that with all these measures put in place, it will be easy for this approach to be deployed in Nigeria and other settings where the intention is to increase the number of people who are trained and knowledgeable in the rollout of PrEP across the world. Thank you.
Thank you so much, Wally. That was terrific. And we had a number of questions come through. I know originally we had planned to wait till the end, but I think we should just allow some responses for these so they're timely. And I know that Jason Reed from Jhpiego has been responding to them as well in the chat, but maybe I'll just allow them to be verbally commented on. So for the first question, it was, how do you make sure targeted health providers can access this essential tool, i.e. the WHO Jhpiego training tool on PrEP? And what about, common barriers to internet and power outage, which I know you addressed as well. Jason responded that the course was available for offline completion and an instruction sheet is provided to all clinicians registering, so they have an option for online or offline completion. I don't know if you have any further comments you want to make on that, Wally.
The comment by Jason is adequate. The third thing I want to add is that it's also critical that you have a support team on ground who can promptly address some of these challenges, because we had a lot of questions from the trainees on some of the challenges they had connecting to the website and also connecting to the webinar. And this is why I highlighted that it is critical that there is a group of people that are available among the organizers of the training to provide this technical support to the trainees. Thank you.
Thanks, Wally. And another question was regarding, one challenge of students or participants in a training online being able to just click next, next, next on the slides until they get to the quizzes so that they can get their certification without necessarily going through all the material. So Jason also responded to this one, that at least for the WHO Jhpiego PrEP training, that students cannot advance through the screens until the narration and animation have moved to completion. I don't know if you have any further comments or anyone else wants to talk about how do you keep the participant engaged in the training rather than clicking through? And Julia might have some thoughts on that as well.
And I just was going to ask if I could just briefly comment on that. That's an argument for making sure that the learning is lean as possible. We know that knowledge dumps don't transfer. So if you create your e-learning that it's primarily case-based, in fact, some of you know, some of it can be designed as a game, you know, choose your own adventure, whatever. They're expensive to create and a little bit complex, but if you make it case-based and very Q&A, then you avoid that problem completely. Thanks.
Any other comments on that? Okay, there were a number of requests for a link to the WHO Jhpiego PrEP training, as well as a question about certification, and the link has been provided in the chat. We will also include it in the resource sheet. And if you complete the course with 80% or higher on the quizzes, then you can print a certificate of completion. I might ask you though, Jason or others, to comment on, to the extent that that certificate of completion is considered to be credit to the national government, depends on agreements with the national government, I would assume.
Yeah, that's correct. It's up to each national government to decide what certification is entailed in their country.
Jason, can you speak up?
Yeah, sure, sorry. So you're correct, Christine. It's up to each national government to decide what is required to meet criteria for quote unquote certification or credentialing. So
Can I add?
the
Sorry,
course
Jason.
just merely indicates that the person has completed the online training and the examinations with 80% or greater.
Yeah, just one comment with that, Jason, is, you know, in most countries, you know, the professional councils or associations will have CPD requirements linked to relicensure. And so you can submit external courses to the councils or association, as you're saying, for formal approval, like it results in X number of continuing education units. And I think Michelle had a comment.
Hi, everybody. This is Michelle Rodolph from WHO. And I just wanted to add to the pieces from Jason and Julia, just to really emphasize that this work was really done very much as a partnership with WHO. And when I say that, Jhpiego did the legwork, but this is really a very accurate reflection of the guidance from WHO. And I just wanted to make it clear to everyone on this call that this was really a partnership with the two, and that we're in links with Jhpiego to make sure that when there is updated guidance, that will be reflected in the tool moving forward. And I don't know if Jason or anyone else wanted to comment further on that, but just I thought I would put it out there. Thanks.
Yeah, for example, Jason, I know that Jhpiego and WHO are currently working on an update to the training related to event-driven dosing of PrEP.
Yeah, that's correct, with Michelle.
Yeah. And, you know, I don't know if this is something to be taken offline, but I know that a number of folks in the Q&A are mentioning that they actually didn't have an option to print a certificate.
That's correct. I'm responding specifically to that issue.
Okay, great. I just, one other question was around this for Wale was, when was the training conducted, this, you know, the webinar based, or the virtual engagement related to the WHO training, and how was the government of Nigeria involved?
Yeah, thank you. This activity was done in the month of May, and because this was a pilot for us to see how this worked, and considering the challenges of COVID at that time, we had some challenges engaging with government, but we already put it in place that for the second and the third cohort, we will involve NACA and NASCAP on this. I'm already in conversation with NACA on this.
Great, and I think you can see the name of our representative from the Nigerian MOH on the webinar today, and can follow up directly as well. Wonderful. I think we're going to move on, even though there are more questions, but in the interest of time, we are going until half an hour after the next hour. So I'm not sure what time it is where the rest of you are, but we have another 45 minutes. But nevertheless, let's move through and hear about the Wits RHI work in South Africa. And then we'll have more questions at the end. So over to you, Elmarie and Nkunda.
Thank you very much, Christine, and thanks a lot for this wonderful opportunity to share our experience with you. My name is Elmarie Breedenhan, and I'm going to be tag teaming with Nkunda Vundamina, who is my incredible colleague. Next slide, please. So we as South Africans like to believe that we're really good storytellers. And so whenever there's an opportunity to be a storyteller, we try and grab that with both hands. And so in order to tell you the real story behind the clinical management of oral PrEP online training, we also need to tell a couple of other stories. And those stories are South Africa's incredible vision of rapidly scaling up oral PrEP to reach all populations that are at substantial risk of HIV infection. And this is really wonderful vision, and we want to really tell that to the world. And then also Project PrEP, which is a project funded by UnitAid. The project's mission to understand and really document best practices in providing PrEP to specifically adolescent girls and young women through public healthcare facilities, so real clinics on the ground. We also need to tell you about the innovative approach of the www.myprep.co.za website. And then we also need to move on and tell you a little bit more about how we went about developing an online training that is engaging, but also easy to follow, applicable to different cadres of health staff, and informative and really easy to get out there to everybody that needs to be involved in it. And then finally, we're going to end off our story by just quickly telling you about our future aspirations and our planned next steps. Next slide, please. So, oral PrEP scale up in South Africa. And the big idea behind this is increase the reach and impact of oral PrEP. And so what the South African Department of Health had a look at was to say, okay, how do we get PrEP to more people? We know it works. We know it's an incredible biomedical intervention. And while South Africa initially had a phased approach, they now made the decision to provide PrEP in 52 districts in all of our 9 provinces, in all 3,100 plus primary healthcare facilities. And this would happen in 4 phases over 12 months. And so the facilities that came in the first phases were just prioritized according to impact and population reach. And the whole idea here is that PrEP should be integrated into all public primary healthcare clinics, where a comprehensive package of primary healthcare services is already provided. And so you can see from the bullets there just where the key inputs were sourced for this model. Next slide, please. So rapid scale up. It requires a new and innovative approach to train healthcare providers at scale and at a rapid pace without compromising on quality. I often think that rapid is probably one of the most used words when we're thinking about the work that all of us are doing. Things always need to be really rapid. And so the idea behind this training is previously what we would do is travel to different provinces and different districts and sub-districts, and we would set up in-person trainings, and we would spend a lot of time with healthcare providers and counselors and demand creation officers, and we would be conducting training. Now you can imagine if PrEP has to be scaled up to 3,100 plus facilities, then it becomes a very daunting task for a group of trainers to travel all across the country. So we thought, okay, how can we make this a little bit easier? Next slide, please. And so what did we need to make this happen? So first of all, we already had the face-to-face training program for healthcare providers. And this was delivered by a team of professionals. So it was a comprehensive one-day training, and it happened face-to-face with different supporting partners, and it covered the clinical aspect of PrEP, demand creation, counseling, as well as monitoring and evaluation. So we already had that approach, right? What we also had was an innovative website. And this website, we keep on calling it innovative, and we'll get a little bit later to why we say that. But just a shout out to our people at AVAC who helped us conceptualize the idea behind the coding. But this website was set up to specifically target healthcare providers. And so under that section, there would be a load of resources, frequently asked questions, that kind of thing. But the website also has a section that is specifically geared at PrEP clients, so support for them. And then finally, it also has a section that's directed at the general public. And so this section is more about looking at community buy-in and how do we make sure that people understand what is PrEP and why we need PrEP as an additional HIV prevention method. And so just to also give a shout out and to say this myprep.co.za website was built collaboratively by Options and then also by Project PrEP with the support of Unit 8. We're very grateful for that we could really put out something great there. And so the website uses material-based design, and if you don't know what that means, that's okay. I didn't either until I really explored it. And what this means is when you look at the website, it mimics the style of many of our social media platforms. So for instance, if you think about Facebook or Pinterest or Instagram, where information is not necessarily divided into pages, but into tiny little cards, so little bite sizes of information. And then the other thing that we already had was a partner, and this is Project PrEP, whose mandate it was to be catalytic in the scale-up of oral PrEP in South Africa, and also have a real focus on capacity building. And this is where Project PrEP then came in. And so all of these things came together really nicely, and this enabled us to create this online training for healthcare providers in South Africa to prepare for the scale-up of oral PrEP to all primary healthcare settings. Now, it's important to also mention, and I think some of the other panelists and speakers mentioned this as well, we can't just put online training out there and expect that, you know, we've built it and now people will access it. And so this is supplemented by clinical mentors who provide guidance and advice. And it's also important for me to note that the Department of Health plays a really big role in making sure that this training is disseminated and shared with all the correct people. Next slide, please. So just a quick little bit, this is where my story is all about Project PrEP. And so Project PrEP launched in 2018. It's an initiative that's carried out by the Wits Reproductive Health and HIV Institute, and it is done in close collaboration with the National Department of Health. So we really work hand in hand with them to understand what is the need and how can Project PrEP be catalytic. So one of the components of the project, which we're very focused on, is provider training and making sure that both Wits RHI and Department of Health teams at facilities across South Africa really have access to resources that will build their capacity and give them confidence in what they do. And so as NDOH moves to this massive scale-up, the task remains to reach and train the different cadres of oral PrEP providers. So this is where Project PrEP really came in, and that's their part of the story. So can we move to the next slide, please? Okay, here's the part about the website. So remember, I kept on saying that it's innovative, but let's have a little bit of a deeper look at why do we keep on saying it, because it's just a website, right? So in response to the National Department of Health, this online platform was created really to make sure that everybody who wants to know anything about PrEP would have easy access to all the different resources, but that they wouldn't have to sift through paragraphs and paragraphs and pages of information, but that they would be able to really easily see, okay, this is what I'm interested in, this is what I want to know. And so if you look at the picture on your screen, you'll see that the website has been divided up into cards. And so if you look, for instance, at the little card in the middle of the screen that says, does PrEP provide other protection? That is one card. So that essentially counts as one page of a website. It's one card. You'll also see to the left of your screen that there is still a navigation panel, but it works a little bit different from traditional websites. And so through this panel, you can navigate to any card on the website. What you can also do is you can look at a card, and if you really like that card and you want to save it for later on, you can add it to your favorites. And then you can also see that you can share that specific card in the way that it looks right there to your social media. And so, as I mentioned, this site has been developed for users, providers, and everybody else, and it's just been split nicely across those audience groups. So, material-based design, the use of cards, and it mimics social media. Also just want to quickly mention that we also have a gamification function. And so if you look to the top of the website, you'll see there's a little sentence that says, is PrEP for me? And in essence, that's a little game that a person can play. We call it a game. It's more of a serious game where you can click through different responses to do sort of a self-assessment about whether PrEP could possibly be a good option for you. Next slide, please. And so this is the landing page of the website. And I just quickly wanted to tell you about how the website has been doing. And so since its inception, which is just over a year now, we've had more than 100,000 total users. You can see that there's a number of different sessions that was done, and also the different page views on there. Then what we did was we simply took the online training and we added it to this website because we knew people already liked this website and interacted on this website. And so if you look to the top of your screen, you'll see that is where the online course for the clinical management of oral PrEP is homed. Last thing that I also want to say, if you feel like having a chat with someone, Sister Unati lives on this website. If you look to the bottom of your screen, just above the Unit 8 logo, and she's there to have a chat with you about oral PrEP, and recently we've also built out her knowledge to talk a little bit about COVID-19. So if you're feeling alone and you want to have a chat, Sister Unati is there for you. Next slide, please. Okay, so just a quick look at what does registration look like. We know that whenever we go onto a website and we're required to register for something, it's something that most of us see as a barrier to access. And so we try to keep it short while making sure that the National Department of Health is able to get as much information about who are doing these courses. So this is just what the sign up looks like. And how we've split it up is to make sure that we understand the category of staff, what their role in relation to PrEP is, their province, their district, sub-district, the facility that they're working in, and also their sector. And so once you've completed this process, you'll land on a screen that looks like the screen to the right of what you're looking at right now. Next slide, please. So finally, before I hand over to my colleague Nkunda, I'd just like to show you a little bit of what the reporting dashboard looks like. So currently what you see on your screen is the number of registrations per province. And so while this is an online process, we are also able to send people course content, and they can do it offline, and we can register them manually. And so Nkunda is going to tell you a little bit more about how this course has been broken up. And so there's different modules to this. There's an overview of oral PrEP. There's the clinical management of oral PrEP. There's general awareness regarding oral PrEP, and then also the counselor's guide to oral PrEP. And so if you look to the right of your screen, you'll see how many different courses have been done in the different fields. And you'll see that the clinical management of oral PrEP is the majority of people who've been doing that. And then finally also, if you look to the bottom of the screen, you'll see you're able to capture all of this information and export it as an Excel sheet as well. And so that's where my story ends, and I'm quickly going to hand over to Nkunda to tell you the rest of the story.
Wonderful. Thank you, Almarie. So I'm going to just quickly talk you through the steps that went into digitalizing the online PrEP course, as well as give you a sneak peek of what the course actually looks like. Next slide, please. So the process of digitalizing the course was divided into two main phases, which includes the development and delivery. The elements that fall under development include the planning and design. So in this phase, we created a design brief that was sent to different service providers for their proposals and quotes. And we then identified an appropriate service provider following a very rigorous procurement process. And the selected service provider then designed a detailed storyboard for the course layout and refines the script based on previous in-person training content. So then we then moved on to the development, and the service provider developed the animations, the recorded voiceovers, in-person videos, and developed the online platform on which the course is currently hosted. We then moved on to testing, reviews, and reverts. So the course developed was reviewed throughout the process, and reverts were made based on feedback by the National Departments of Health and other partners. The next phase is then delivery. So the course was launched on the 25th of November, 2019, and is accessible, as Almarie mentioned, via the MyPrEP website. And she'll let us know later on and talk to us about further improvements that we plan to make to the course. And also an important highlight is just to say that the National Department of Health was closely involved and still is in the planning, development, and any future work that needs to be done to the course. And their input has been valuable, immensely valuable at every stage of the course. So we're very grateful for that. Next slide, please. So Almarie talked us through how a person goes to the website, the MyPrEP website, and how they find the course by going to the training tab. So what does the course look like when someone logs into it? So once the learner logs onto the course, they're then taken to their dashboard, which you can see on your right-hand side. And they'll be able to see what course they've been allocated, as you can see at the top in the yellow box. Just to say that when someone is registering for the course, depending on what role they play in their facility, that's the course that they'll be allocated. So if they're a counselor, then the system will automatically choose the counselor's guide course for them. So we also have an option for the offline course, as Almarie mentioned, and each learner who logs in can see the option to download an offline template. They can complete it and then upload it in their own time or when they have access to data, and the system will automatically read through what they've uploaded and generate a certificate for them. Next slide, please. So just a big thank you to Nikita, who produced a video for us, a really short clip, and that gives us a nice overview of what the course is actually like. It's a very short video, and you can play the video. Thank you. There's no sound playing, sorry.
One, the basics of oral.
Thank you.
In this course, we will take you through the following 7 themes in the introduction video. In this video, we will explain how the whole course works and what you need to do in order to complete it. Theme 1, the basics of oral prep. In Theme 2, screening process. Theme 3 explains the whole initiation process. In Theme 4, we look at the information and messaging regarding oral prep. Theme 5 illustrates the side effects and requirements for managing oral prep optimally. Theme 6, we discuss when and how follow-up visits should be conducted. And lastly, in Theme 7, we discuss what is required when conducting follow-up counseling. We are sure that you will find this online course informative and that it will assist you in preparing for the few certification questions we have positioned at the end of each theme, as well as the final assessment at the end of the course. You will need to watch the video for each theme and then answer some checkpoint questions at the end thereof. Remember, you can watch these videos as many times as you need to. Themes are locked at the beginning, and the next theme will only unlock once you have completed a theme. There is also a final assessment at the end of the course. You will have 3 attempts to pass this final assessment, and the pass rate is 85%. Once you have successfully mastered each theme and the related questions, as well as passed the final assessment, you will be issued with a certificate of completion for the course. Your certificate will be emailed to you. If you are unsuccessful after your 3rd attempt at the final assessment, your themes will be reset and you will be able to try again. This course will contain everything you need to assist you in the clinical management of PrEP. Good luck and have fun with your learning.
Thank you for that. So as you can see, the course is animated, it's got voiceover, so it's got a mix of different techniques. So it's not just reading a slide or not just listening to someone's voice, and it's very interactive as well. So how have people responded to the course? Next slide, please. Right, so as mentioned, the course was launched in November on the 25th. And to date, there have been 4,406 registrations across the provinces. And about half of those people have completed the course. And we've seen 696 facilities represented. So it's been quite a positive response. Next slide, please. So as Almarie mentioned, we divided the course into 4 different courses that different cadres of healthcare professionals can register for. So we've got general awareness, which is just an overview of oral PrEP, and then it caters to peer navigators as well as counselors and clinical staff. So as you can see, there's been 397 registrations for the general awareness. In terms of peer navigators, there have been 957 registrations. For counselors, there's been just over 1,300 registrations. And with clinical staff, we've seen just over 1,700 registrations. Next slide, please. So we just got snapshots of what different slides look like, or what's different views that participants will look at. So the course has a certification process, which is assessment based. And this means that at the end of every module, they get an assessment, and before they proceed to the next module, they need to complete and pass the previous module's assessment before they can move on. And then overall, there's an overall assessment for the whole course, and after which participants then get a certificate. So just to give you an overview of what's on the screen, so you're looking at a congratulatory slide, which just says you did it, you reached the end, only the final certification assessment remaining. So it kind of gives the participants a progress on how much more they have to do or how far they are in their learning. We also have a screenshot of what one of the assessments look like. on what the final assessment looks like. We also have a copy of Elmary's certificate, and this is what participants will get, as well as their final mark. So that's it from me, but I'm going to hand over to Elmary to just finish off our presentation. Thank you for listening.
Thank you, Nkunda. So just to end off our story here, we wanted to tell you first about the lessons that we've learned. And so originally our plan was to purely just do a clinical training. And what we quickly learned is that we needed to cater to the different cadres of providers. So there needed to be something for clinicians, something for counselors, and something for peer educators, and also for M&E staff. And so we had to very rapidly adapt and make sure that we build out the course in that way. Then we also, in going through this, realized that if we want to get as close as possible to sort of face-to-face, that we need to make this training really interactive. And so we used mixed methods. Like Nkunda mentioned, we have animations, we have music, in-person videos, graphics, voiceovers, as well as text. The other thing that we learned and that we had to really quickly do as well was that there is a lot of connectivity issues. Not everybody always has access to a computer with a stable internet connection. And so we needed to make sure that there was an offline version that people can work on as well. Then we also realized, and this was mentioned by other presenters on this webinar as well, that it's absolutely vital that there should be support to participants afterwards. Another big lesson that we've learned, and I'm sure a lot of people already know this, but it's a lesson that we keep on learning, is that you must find a suitable service provider. You know, collaborate with a willing is one of the biggest lessons I've learned, and finding the right service provider who's able to understand your needs and adapt as quickly as you have to is really important. Then the reporting interface, that's a lesson that we're also still learning. Even though we do have a great dashboard, there's a lot of fields that we can add to that, and a lot of ways that we can present the data to make sure that it comes across even more accessible. Then just in terms of our next steps, we are looking at adding additional modules to the training. Of course, this is kind of a costly exercise, but we're trying to see how can we do it as cost effective as possible. And so what we're currently busy adding to this online training is an HIV prevention ambassador module for young people. And this training was originally also developed by the Options team. Then furthermore, we're also doing adaptations to these PrEP programs in light of COVID-19, and therefore we're also exploring the need to maybe see how can we add to this training the updated guidance in terms of PrEP provision and other HIV prevention service provision in the light of COVID-19. And so that is our story, and we hope we've told it well, and thank you for listening to us.
Thank you so much, Elmary and Nkunda. That was really terrific, and there is a lot of interest in this training, not surprisingly. I think one of the first things we should clarify is that, so the South Africa virtual training or online training is for South Africa providers that include multiple different cadres. The WHO Jhpiego PrEP training is not restricted to any one country. Anyone can take that. But it is just for clinicians. So that's one point of clarification. But I think what would be helpful, Elmary and Nkunda, and I know Saika is also in the panelist room, is to talk about who can take this course. Because as you know, if you go on the South Africa webpage, you have to indicate what facility you are with. Versus, I believe we have posted a version of this on PrEP Watch, that anyone could go through, but it's not linked to the whole South Africa NDOH certification process. Do you want to comment on that?
Sure. So I can jump in there just to say that the training has been set up for people who don't just work in public health care facilities, but also partner organizations, for instance, like Wits RHI or another partner in South Africa who's supporting facilities. And so the registration process does tease that out. If you are from outside of South Africa, we would advise that you look at the training that is available on PrEP Watch. And that's just because we're really trying to keep our M&E and our data in relation to who's completing this as clean as possible.
Yes, so I see definite interest from Nigeria and Kenya and others in this training. So I don't have it handy right now, but Katie, if you can find the PrEP Watch link and put it in the chat. And we will also include that in our resource sheet after this webinar, so that you know, one thing that a country could do is either adapt this training, contact Elmarine and Kunda if needed help, or use that PrEP Watch version. One thing to note though is that the South Africa training reflects the South Africa guidelines on PrEP. And as we know, PrEP guidelines are not always the same in every country. For example, different countries have approved guidelines for different frequency of creatinine testing, or perhaps no creatinine testing in some countries. Different countries allow PrEP for pregnant and breastfeeding women, and some don't yet. And so those who are using this training from another country should be aware that there may be adaptations needed to match the national guidelines in your own country. I think there were a number of questions regarding you know, who can take this training, and I know some of that was addressed in the chat, but maybe you want to comment on all the different groups that can take the training. And there were some questions about how to correct errors if a certificate misprinted a name, and maybe that's something that needs to be offline, but go ahead, Elmarie.
Sure. So as we explained, so the training has been set up for anybody in South Africa who's really working on PrEP. And so when I, for instance, registered for the course, I'm not a clinician. So I indicated that I work in demand creation. And so I received the different courses that was applicable to that. And so when you register for the course, it asks you a number of questions, and then based on your responses, you will get the selected modules. So there is also an option that if you've perhaps registered for the wrong courses, or you want to do all of the courses, you can contact an administrator who will then assist you just to correct that. And so if there is a mistake on your certificate, that might be because you've made a typing error when you put your name in, and that's also something we can correct. And Kunda is the person who does that. And but there is also an option to contact an administrator who will help you with that.
Thank you. There was another question asking who monitors the training progress in South Africa, meaning who tracks the number trained per province, etc.
So we pull that. If you looked at the dashboard, you'll see there's an option to export an Excel sheet. And so what that does is that gives you all the names of everybody who's registered, what kind of course or module of the course they've registered for, whether they've completed it or not. And so that list gets pulled and then gets submitted to the NDOH. The NDOH also has direct access to this dashboard. And so periodically, they would also pull from there to see, okay, where are we standing and who's done what?
And I have a question about, and this might be related also to the previous speakers as well, which is, how do you handle the refresher training? Or is there a set frequency that the training needs to be repeated? Do you have any ongoing communication with those who have been trained after they've completed their training?
So I'll go first there. And just to say, with this training, it is fairly complete. And what makes it really great is the fact that there's mentorship afterwards. So a number of facilities, especially those providing PrEP, are supported by mentors who they can connect with. And then, so that really is the support in terms of that. And then anybody new who comes into a facility and who starts to work on PrEP, whether you're a counselor or a demand creation officer or a community health worker, they are requested to do this training. And then the other thing that is great about this is that even if you have completed this training, but you want to go back and just check yourself, you can go back and do any of these modules at any time.
Thanks, Elmarie. This is a question for the whole panel. I'm interested to know the required expertise and cost related to developing these virtual trainings. I know that we've been exploring some of these questions with the projects that I supervise, and we're struggling to find access to what we call an instructional designer, which we think we need to help adapt in-person training to virtual. Not sure if that's really necessary, but Julia, you outlined a number of really important considerations in doing virtual trainings. How do people in the field get this expertise, and how much does it cost?
So that can vary a great deal. The type of interactive, like the South Africa platform that they showed, that type of multimedia engagement, can be very expensive. Some of the quotes that I've seen are it can cost up to 10,000 for a 45-minute, interactive seat time can be considered like a moderate cost. It can be extremely expensive. I will say a couple lessons we've learned is, because the countries have so much, as they should, ownership and control over the product, we selecting like a local vendor, or I think Elmarie, you referred to that as like, I forget the people that did the production. If you find a local company, that's definitely a recommendation for reducing costs, but there are a lot of options now for producing e-learning more efficiently. Like, I guess I won't go into the details because that would be long, but it can be the more interactive and the more multimedia, the more expensive that it can become. But I can send you like offline, Christine, we had come up with some different estimates of what it takes. I do think, people think you can just take people that do live instruction and say, okay, go create an e-learning course. And I would not in any case recommend that. You really should find an e-learning production company that has an instructional designer, an instructional technologist, someone that can do quality assurance. And it looks like, I think South Africa went that route. I don't know if anyone else wants to add to that.
Yeah, I would just add to so in designing or collaborating on the WHO course, we had our own instructional design team develop the content. It took well over a year to do. And I would say that I think it's easy to talk about adaptation and can we just adapt one country's for another. But when we even do the most simple adaptation, like Michelle from WHO mentioned, we've just finished an adaptation to include the event-driven PrEP. It's a major undertaking. All the narration has to be redone. All of the graphics and interactive multimedia has to be redone. So it's not, even though it sounds simple to say, well, we'll take this country's course, but we'll switch out tenofovir emtricitabine for tenofovir 3TC, and we'll use that course. Doing that from an instructional design standpoint and managing all of the stuff on the back end for that is quite an endeavor.
Yeah, and so I was just going to say on that one comment would be that at least the WHO Jhpiego course is across countries. So there is one course available for those who don't have the resources to do a country-specific adaptation. Go ahead, Julia.
Sorry, I just wanted to say there are like new functionality, like in the authoring software that's used, like the one that was used for the WHO course. They have new functionality that prioritizes using existing assets, etc., but it's not going to be as engaging as, you know, creating interactions or multimedia. So things are cheaper to produce, but it's not as straightforward as people hope that it would be.
Elmarie and Kunda, can you comment on cost and time and resources required to produce this?
Sure. So as I mentioned, this was a request from NDOH for Unit 8 to support them with this, and it came in, and it was quite a rapid process. And so completing this whole online training took us just over 3 months, but we did really work ourselves silly. So in terms of the team that put it together, so you would have noticed that we have a clinician in the video, Danielle Travel, and she's part of the Power team, and she's also the clinical trainer for NDOH when we do face-to-face training, and so she was very involved in the process, and the whole training team helped with putting this information together. And then we did have an organization who's really well-versed in e-learning, who's really got a lot of experience in doing this kind of thing. And so they helped us to digitize this. And the training in total, if you were to do it, would be about 1 hour, 30 minutes. And the cost in related to that was just under, I think about $20,000.
Thanks, Elmarie. I see a question. Is there any guide for the selection of participants who would be committed to the training and subsequently graduate within the allocated time? So I think this is guidance on who should use these trainings.
Christine, is that question for us?
I think it's an open question. It's in the Q&A.
So from a South Africa perspective, the National Department of Health plays a big role in making sure that the training is disseminated to everybody who works in PrEP. And so it is a requirement for them to actually do the training, and that is followed up on.
Thanks, Elmarie. So we're approaching the... Oh, go ahead, Jason.
I was just going to say, from the WHO Jhpiego training, different countries have used it in different ways. Some countries have specifically used it for clinicians that have no experience but who want to begin managing PrEP clients. And then other countries have used it as a refresher training tool for providers who have previously managed PrEP clients but have rotated to a service that's different and have come back to PrEP service after some time.
Thanks, Jason. And I'm going to, yeah, I was going to say, any panelists who want to make any final comments, go ahead. Go ahead, Robin.
Thanks, Christine. Hi, everybody. This is Robin Eckel, USAID. I was trying to speak earlier and I was double muted, so I didn't realize. But I just wanted to come back to the WHO and Nigeria pilot there, and just to emphasize for everyone that I think that there are ways that to use the existing WHO training platform, which hopefully is lower cost, where you can adapt it for potentially different cadres. So by adding in, you know, a facilitated webinar like we have around counseling, or, you know, local context, so that it's something that can be used more broadly and hopefully at a much lower cost. And so I think that's something we at USAID are committed to sharing broadly across countries once we've really worked out the kinks in Nigeria. So please stay tuned for that. But I also wanted to compliment Elmarie and Nkunda and the team in South Africa for such a cool online training platform.
Thank you. Thank you. We really appreciate that.
Thanks. Wally or Liz, do you want to make any final comments?
Yes, from me, I think it's just to express our appreciation for the opportunity to share this experience from the pilots. We think it is an approach that we can use to reach a large number of healthcare workers within the constraint that COVID-19 has imposed on us. And we are open to feedback from others to ensure that this is a very good opportunity for people to use. Thank you.
Thank you so much, Wale. We have 3 closing polls because we want to get some information from those who are participating that might inform future work in this area. So I'm going to just stop there and allow time for us to do our closing polls. I also want to note that our next webinar is on July 23rd, and it is on the topic of avoiding stigma during PrEP rollout. So our closing polls, if you could just participate, the first one is asking what country you're from. You could just click on that and submit. And then there are 2 other questions after that. We would be so grateful for your participation. And then once again, I just want to note that we will have a resource sheet that is sent out. We have our virtual learning network webpage on PrepWatch. You can see the link on this slide where all of the previous PrepWatch Learning Network webinars are housed, including the resource sheets, and this one will be as well. So I think that's all we have. Is there any other slide, Aubrey, or are we done? I just want to thank our, oh, here's our next, sorry, we're going through the polls here. So one is we're trying to understand whether or not your PrEP program currently uses a virtual provider training approach. So please respond to this. While you're responding to the poll, I will just give a real shout out and thank you to our speakers and panelists. Really very impressive work across the board here. And so appreciate the time you took to put these presentations together. And is there a third question, Aubrey, or are we waiting for this one? And here is the third question. Okay. Is this the last question, Aubrey?
This is the last question, yes.
Yeah.
So I'll just leave this up as we end.
Okay. Yes. So, and just to respond to Tin Tran, who sent us a note asking if there will be a recorded file of the webinar. Yes. So on that PrepWatch site, we will post the recorded copy of the whole webinar so that you can re-listen to it there or share it with your colleagues. So again, thank you to all attendees and presenters. We look forward to seeing you next month at our next session on July 23rd. I wish you all a good day, a good evening. Stay safe, and let's continue the innovation in our virtual efforts to expand PrEP scale up around the globe. So thank you all.